What does informed consent for Lunesta, otherwise known as Azopiclone, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about Lunesta, and Lunesta is a Z drug, which is one of our hypnotics, meaning a medication that we use to help induce sleep. And like other Z drugs, it's going to act on the GABA receptors. Now, this is the same mechanism of action. However, it is more selective to certain GABA receptors, which in theory means that there are fewer side effects and fewer risks, less risk of dependence, etc. In practice, is that the case? Well, let's talk about it. Lunesta is FDA approved for both falling asleep and staying asleep, but it can also be used off-label for things like restless leg syndrome, generalized anxiety disorder, pain management, and irregular sleep schedules, like if someone's working an overnight shift. Common side effects include having an unusual or unpleasant taste in the mouth. This actually happens in about 34% of patients. People can also experience drowsiness, dizziness, headache, dry mouth, stomach upset, sometimes cold-like symptoms, or a rash. In terms of more serious adverse effects, there is the risk of complex sleep behavior disorders. So things like sleepwalking, night terrors, sleep eating, sleep driving, all of the above. Sometimes people can have an allergic reaction or something called angioedema, which is where you get swelling. And there can be other psychiatric effects like feeling depressed, having SI, getting agitated. Sometimes people experience hallucinations or they experience memory issues or confusion. It's also important to keep in mind that for some people, they're going to feel the after effects of this medication the following day. So it may be affecting their ability to get up and go to work or to drive. It's also a CNS depressant medication, meaning that when it's used in combination with other CNS depressants, which maybe that's benzodiazepines or alcohol or opiates, then those things are going to compound on each other and increase risk of things like respiratory depression. And of course, there's also the risk of dependence and withdrawal. So even though these Z drugs are supposedly less likely to cause dependence issues than something like a benzodiazepine, it absolutely still happens. And I would say that it's the norm rather than the exception. And of course, withdrawal typically looks like the opposite of the effect of the medication. So that may be agitation, insomnia. And what's the difference between Lunesta and the other well-known Z drug, otherwise known as Zolpidem or Ambien? Well, Lunesta is going to be a bit longer acting, and it is approved for both falling and staying asleep rather than Ambien, which is primarily for falling asleep and it's shorter acting. They're both going to be scheduled for controlled substances, meaning that there are additional precautions that must be taken with prescribing this medication due to the risks of dependence, withdrawal, and misuse. In order to get off of these medications, it's probably going to take a hyperbolic taper approach in order to prevent significant withdrawal symptoms. So this means decreasing by a set percentage of the dose rather than a set milligram amount with each dose reduction. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings that I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.